7:28 on your Sunday morning. We are talking about prostate cancer. It's the second leading cause of cancer death in men, yet so many don't like to talk about it. Here to explain why and what newer innovative treatments are now available is Dr. Giesler, urologist with the urology team. Thanks for being here with us this morning.
Thank you.
So why don't men like talking about prostate cancer?
Well, I think, men being men, we just don't talk about much. We have conversations in the form of a sentence. And I think it's really a generational thing. Obviously, people like our fathers, and even my age group, we don't really talk about more private things. What I'm seeing, though, is our younger millennials, to be frank, are coming in more often and are more concerned about their health and very open. And so I think we're seeing maybe a shift. And I really credit women who have been very vocal in breast cancer to really lead a charge in just being cautious about one's health.
And when and how do you start that screening process?
That's a great question. Men sort of have a 50-year warranty. So around 50, we start breaking down. Women earlier in life, especially when child-rearing age comes, doing cervical exams and breast exams. Men, we really don't need much until we get into our 40s and 50s. 40s for men who are African American or family history. And then if you don't have any prostate cancer in your family, 50, 55.
And we were just looking at some video there of the newer technologies. It really has come a long way.
It has. And, it's sort of been an all or none traditionally. You either do nothing with prostate cancer or you treat the whole prostate. And now with newer innovations in imaging, especially MRI, we have a good way to look at the prostate and therefore really do precise treatments.
And we hear cryotherapy for muscle recovery. Is it kind of the same concept?
Well, in a sense, but we freeze it a little more to kill the tissue, whereas the cryotherapy for the body is for restorative. As a runner myself, a lot of my friends do that after long races, and it's great for recovery. But here, we're not trying to recover anything. We're trying to kill the tissue, so we freeze it to a very cold level, very precisely, to kill that zone of the prostate. And anything within that ice ball is dead and just scars up.
And catching the cancer early, just like with most diseases.
Right.
Why is that so important for you all?
Well, it's so important because, we see that prostate cancer is still the leading cause of cancer other than skin cancer in men, and it's one of the highest mortality rates. So, about 30,000 men a year, and screening will prevent 1 in 1,000 deaths. So catching it early, not only does it offer men a prevention of cancer-causing death, but more importantly, it offers a treatment that could minimize side effects that would plague those men every day.
And we are coming right off of Prostate Cancer Awareness Month. Every month, though, should be.
Right. It should be health awareness for everybody. And, September is typically prostate cancer awareness. In November is Movember. That's where men, including myself in the past, my wife doesn't approve of a mustache. We grow mustache. Yes, it's a great cause. I may do it again. My whole office does it. And it's a lot of fun.
All right. Anything else that you would like to encourage men to consider?
I just think men and women just support your spouses, your loved ones to get to the doctor once a year, get your body checked up. And if we do that, we really pay big dividends in the future.
All right, Dr. Giesler, thanks so much for being here. We appreciate your time. All right, 7:31.